Good afternoon, my name is Marissa Darby, and today we'll be discussing how we can improve the surgery process in workers' compensation. First off, what is workers' compensation? This is the insurance provided by your employer when you injure yourself due to the work environment. For example, you slip and fall at work and you're sent to your nearest clinic. There the doctor informs you that you will need surgery to repair your broken ankle. Having been in workers' comp for almost 3 years, I've come across countless patients that do not understand the process of surgery. So by getting doctors involved, patients involved, and getting our staff trained, we can start to see improvements around the office. First, we need to train our doctors to use simple language. For example, using the word harmful instead of hazardous, and saying to take instead of ingest. This is because doctors will use medical terms that just go right over your head and it's not clear what they're saying. So these office appointments may be a little bit longer, but they will be necessary to ensure that patients know what happens before, during, and after surgery. We also do see a lot of Hispanic patients that do not speak English, so we need to remember to use our medical interpreters when necessary. Next, we need to get our patients involved. So when our staff is reading off consents, we need to position the forms in front of the patient so they can follow along. Also, we can use the teach-back method to see what areas need clarification and to make sure that everything is understood in the consents, almost like a mini quiz. Afterwards, we will give copies of these signed consents to patients to take home, as well as a map with a picture of the surgical center and directions right below that map. Next, we need to train our staff to stay current in health literacy and class standards. I have found many free online training programs at no additional cost to the company, and we will have our staff complete those every other month to stay current. In addition, we need to improve our brochures. I myself have made a brochure detailing what is workers' comp, the process of surgery, what lab work you may need, what is a medical clearance, and what is detailed in the consent forms, as well as, what happens in your post-operative appointment after surgery. So we will give our IT 1 month to complete these new brochures. So 2 hours a day will be set aside to improve these. I've calculated that it will cost $500 to print 1,000 brochures, and we can have those in the front office as well as in the back where doctors can provide them to the patients. When we have taken all these necessary steps, we can show patients that we are providing quality care. Overall, with all of these standards set in place, we can start to see improvement within the next 6 months. So once again, getting our doctors involved, our patients involved, and getting our staff trained in health literacy and these class standards, we will start to see improvements. Thank you.